Hi everyone, it's Dr. Jill checking in from Healthy Kids Pediatrics. I hope you're enjoying your summer. I wanted to really quickly touch on a topic that is an oldie but a goodie, but we're still getting calls from parents about it. So let's talk about a few tips on how to manage fever. Tip number one, fever is our friend. I know we have fever phobia and it's very upsetting to see your child not feel well and have a higher temperature, but please know that fever is the way a healthy immune system helps fight these infections. It raises the temperature to kill off bacteria and viruses, and it helps mobilize all the immune cells so they can work faster. Tip number two, treat the child, not the fever. You've heard us say this time and time again. Now, if you have a child who's got a low temp of about 100, but they're mopey and not achy, not feeling well, that's a child you can give some Tylenol or Advil or Motrin. Those happen after 6 months old. You can give them some medicine to help them feel better. When they're in a more comfortable position, they actually want to drink more, which helps them stay hydrated. And remember, hydration is much more important than eating during a fever. The body doesn't want to digest, it just wants to heal and get better. And now if you also have a child who's 102, we know a lot of toddlers who have high temperatures running around and they're looking great and they're happy. Instead of giving medicine, give it time, maybe about 30 to 60 minutes to see if the temperature goes down on its own is okay to do. Now, tip number three, remember that if your child is under 8 weeks old, any fever over 100.4 rectally warrants a call to our office and probably an emergency room visit. So please don't give medicine or wait, give us a call. And then tip number four, if your child has a fever over 104 or 105 that does not go down within an hour of Tylenol, Motrin, a lukewarm bath, or some cool rags on the body, that's the time you can go to an emergency room. Even if the fever comes down by a degree, you can stay home and you don't need to rush anywhere in the middle of the night. So hopefully those are helpful tips to remind you how to handle and manage a fever. Have a great day. Bye everyone.